Hey, good morning. My name is Karina Priest. I'm a licensed mental health counselor. I'm one of the counselors here at Ambrosia. I'm the lead therapist here at this facility. I've been a licensed counselor and a psychotherapist for 22 years. And one of my fields of expertise is trauma. And so I have special trauma groups and special trauma sessions that I do for the clients here at Ambrosia. The trauma group that we do once a week. For now, it's just an hour. And what happens is we go over just some of the side effects, some of the things that people have issues with years after they have had some trauma. It's really important that you understand that one of the things that you don't ever have to do is to tell us the trauma story. I never ask anybody what the details are, exactly what happened, because it's not necessary in order to heal. What we talk about are the side effects mainly, how it affected your life, how it affected the way you look at things, relationships, using, and some other coping mechanisms that, some of the negative coping mechanisms. I tend to work with this book, The Courage to Heal. What I do is I try to give handouts out of the different chapters. And we try to work on reminding you, number one, that somebody who's been abused was never at fault, and try to make you realize and look at it from different perspectives. Look at how some of the ways that you may feel today. Sometimes people say, "Well, I feel like I'm crazy because I was abused. So I feel like I'm insane." So I try to help you realize that you're not. Abuse brings a whole lot of side effects. So I give you different perspectives, different ways of looking at it. We talk about creating safety, teaching you how to create a safe environment for yourself. If you need to set some guidelines in your life to feel safe, then I teach you how to do that. And I teach you to build a support system and how important it is to have someone to talk to about this. And usually the people you'll be talking to are not going to be your best friends or your family, but usually somebody in the program or somebody in a support group that you may attend. Because post-traumatic stress disorder is something that you'll carry with you for life, and as different situations happen in your life, some of the effects may be more, a little more there, like more, you may have anxiety, depression, things of that sort, and I'll help you how to deal with those situations, how to get better coping skills. I have a trauma checklist that I usually let you all see, which I have here on my computer, and it talks about, again, some of the side effects, like sometimes problems with anger, problems with trouble sleeping, sometimes eating disorders. So we talk about that, and we talk about how that came about based on the history of trauma. And like I said to you again, we always remind you that it wasn't your fault and that you don't have to tell anybody. And if you decided that you wanted to tell somebody, I'll be there to help you. Part of the program also includes that you do have access to me after hours, so that if we work during the day on something that traumatic and you're having flashbacks or memories and you're not feeling okay, you can have one of the texts have me called and you and I can talk. And that usually it usually helps the clients out. And again, I don't pressure you in how fast to do the book and how fast to do the healing process. Everybody takes their own time. I just encourage you to keep going, because it's the only way that you're going to heal. So I just encourage you to do as much work as you can, but you do some work, you don't like it, you don't feel like you want to keep going, you stop for a few days, and then you go back. And I'm always there available for questions, for comments, concerns. So that's our trauma program. Probably in the next couple of weeks, we're going to add one more piece to this, which is the EMDR therapy, which is one of the latest therapies there are to heal from issues of trauma. And that's coming up. I'm going to be certified nationally next week, and then after that I'm going to be bringing that therapy here. So you'll be able to get group therapy, individual therapy, and EMDR. So we'll have a very complete trauma program that will certainly be an advantage to anybody that participates in it.